Welcome to the Talking HealthTech podcast. My name is Peter Birch. Today I'm at Digital Health Festival 2025 and I'm at BAI Communications and I'm joined by Kevin Zhu and Adrian Ha. G'day gents, how you going?
Good morning.
Good morning.
It's great to see you. It's great to be here in the booth and learn a little bit more about BAI Communications and why you're here at Digital Health Festival and also the relevance to the health tech ecosystem. We might start firstly just to understand a little bit more about who you are and what you do. Adrian, maybe we'll start with you.
Yeah, sure, Pete. So thank you first of all for joining us this morning at Digital Health Fest. BAI Communications, we are by heritage a broadcast company. We are now moving into the mobile connectivity space, helping bring connectivity to customers in the healthcare industry in this instance, making sure that they're aware that there are solutions to be able to improve mobile coverage and then helping them deliver on future type solutions in terms of healthcare connectivity. That's essentially what we're here.
Yeah, excellent. I'd love to learn a little bit more from you about what that means, because it's a little bit different to the other conversations that we have here at whether it's at a health tech event or just generally within the ecosystem. Unpack that a little bit more about why this is such a big issue to address within healthcare.
Yeah, sure thing. So look, nowadays connectivity is more of a must-have rather than a nice-to-have. Especially in the healthcare industry, having good, reliable mobile connectivity is an essential expectation that customers have, patients have, and then staff have within the healthcare industry. Yeah. Without having basic connectivity, doing the simple things such as receiving phone calls, that can be a challenge. In a hospital, that can mean the difference between quick decision or critical delay, which is going to impact a lot of people. Yeah,
no, that makes sense. And I guess it's super logical, I guess. You need to have the internet or connectivity or all of these powered devices need to be able to connect. It almost seems like a given. But, we've all got phones and we've all got access to the internet. There's Wi-Fi, there's 4G, 5G, that all exists. So this is different to what we're talking about here? No,
essentially it is 4G, 5G. So we've got two basic domains of solutions. So first of all, in the public domain, where you're used to the 4G, 5G terminology, and then we've also got private mobile networks, or we call it PMN here at BAI. The public side of things, basically, it's an extension of the mobile network operator mobile signal. So bringing that indoors. A lot of people aren't aware that you can extend that coverage. You can bring that indoors. We're all familiar with coverage issues or black spots where you're not able to make a phone call. Yeah. I've been in the hospitals where you walk into the hospital, staff members are so used to not having connectivity, I'll walk into a specific location just to make a phone call. And essentially that's due to the building materials that are used to build a hospital. The layout of hospitals, the intricacies of the different buildings, that can inhibit the propagation of mobile signals getting into a hospital.
I can think of a load of examples where you're like, I need to stand here when I make this phone call or access the internet because I know that I've got access here. And I also thought, unrelated to healthcare, when you go into Costco, and I just assumed they cut off the access to the internet inside so you couldn't see what prices they were. But they always said that's unrelated to healthcare. But I get it now. I get what you mean. And so you pointed to Kevin in relation to was it the on the private side? Correct. Tell me a bit more about that.
Yeah, that's right. Yeah, as what you mentioned, the private mobile network actually, as it is named, is a mobile network. It actually the same or similar technology as a public mobile network operates by Telstra, Optus, or TPG, but it is private. It's just like you have your own Telstra for your hospital. Yeah. It is built and designed just for you. It is used just by you. So this is why we call it a private. Yeah. So.
And is this the type of solution that I can picture it in, like, say, a hospital setting, particularly those that might be, is it being quite underground or just because it's like quite a dense building? Is that the issues? And then that's kind of like the prime example as to why you need that connectivity inside? Not
exactly, but if for the because it stands or some area have the black spot, it's just what we do for the public mobile network. It's we can extend or bring the public signal from outside inside the building. That is the public, the DAS network. But for the private mobile network, what we do is for internal operation. So that one actually is for many other use cases rather than the generic communication purpose for the voice call or to something like internet access. But that is for internal, more focused on the internal operations. There is quite a lot of use cases different. For example, it's coming from provide the real time patient monitoring. And also can constant patient monitoring, and also they can provide something like with AR or VR devices. Then they can provide something for the this smart AR or VR technology for the surgical theater. So this is more integrated with the operation, rather than for the common use for the guest or for the patients the voice call or internet.
Yeah, we'll come back to the public side, the DAS, in a second, because I feel like, that's obviously a very clear distinction. That's interesting, really focusing on the internal requirements. Is that, I'm thinking that might be due to unique workflows or perhaps heightened security? Like, what are the main reasons why you'd really need that private...
Yeah, that's right, exactly. Another, the private mobile network actually is that is built for both the hospital internal the operation efficiency. That's one way. It's also to streamline the process and also the workflow, and also can enhance the patient staff and also the staff the safety, and also can provide the more patient the better patient experiences and the patient's care. So this is the purpose for for intra private mobile to hospital.
And there's hospitals in Australia now that are powered by this type of capability?
Yeah, definitely, Pete. So there are quite a number of hospitals in Australia that have a distributed antenna system. So I can go into a bit more about that. Distributed antenna system, or short is a DAS.
Yep. Okay.
Essentially, that distributes the mobile signal from the mobile network operators throughout the building. Within each floor, that's distributed to specific target coverage areas, such as emergency departments, offices, stairwells, basements, and even lifts. So essentially what that does is it ensures that there's coverage wherever you need it the most. Yeah.
Gotcha. And so is this, the domain very much of the IT department here? Like they're the ones that you're dealing with on a day-to-day? Because I imagine there's a lot of... It would go beyond that to a point too, because you'd need good... collaboration or engagement within the entire health system too, because it's the front line that's out there, having issues, and some being resourceful clinicians. Sometimes people just make things work and find hacky ways to do things, and we've seen that through different examples of shadow IT and various versions of software and things coming through, because in the end people just come to work because they want to do work, and sometimes they'll make decisions that could potentially compromise on patient safety or efficiency or even security when they're not trying to be nefarious or anything, they're just trying to do their job. So how have you found that the adoption, I guess, or being able to address issues within hospitals and identify that this is the solution for them? Because sometimes you may not know that this kind of solution actually exists.
Yeah, Pete, so I guess, look, we work closely with our customers to make sure that there is the right solution that fits the needs of our customers in the healthcare industry. We look at the design and install of a DAS, and then after that we also do the operate and maintain of the DAS. There's been quite a few instances where you have DASs that have been deployed over a number of years. For whatever reason, they've degraded in performance. And when that happens, there's a lack of clarity in terms of who to go to support that. And that's where BAI can work with you to remain engaged after the design and install of a DAS to make sure that it's operated, it's maintained, and therefore that it's operating optimally.
And is this type of technology something that, is once you put it in, it's going to be good for a very long time? Or like everything else in healthcare, it seems like there's new different technology that's Moore's law or whatever it is, where it's doubling at the super speed. Because you kind of made me think about it then too. I feel like that engagement and ongoing connection is kind of like not a set and forget type thing, right? It's how is this technology evolving over time? Like what was it like, say, even 5 years ago?
Look, the DAS market in Australia, it's probably just over more than a decade old. So outside of the healthcare industry, other industries also have DASs deployed. So where you have commercial buildings, stadiums, areas of mass transit. And as you said and alluded to, a lot of those are a set-forget type engagement. So basically they're built, there is a lifespan that's associated to that, and there will eventually need to be an upgrade. So you have to upgrade according to the technologies, especially the public mobile space. For instance, 3G, 4G, and now 5G. So initially there were 3G only DASs. They've been upgraded to 4G, and then now 5G DASs are happening. And then if we look even further, we've got private mobile networks, which can operate over a DAS, but on the back end of it, it's a separate core network. It's separate from the public domain, so it's not through the mobile network operators, but it's through an operator such as BAI. And that's where we've got that.
Those DAS and private mobile network is not a new technology. Actually, it exists for decades. For example, the Adrian mentioned, the DAS have a quite long history in the market. For the private mobile, actually, it's also 1 decade ago. Initially, it's coming from to the mining sector. To provide automation for the mining. The autonomous vehicles, forklifts, the diggers. To get everything monitored and get me some remote control. Then gradually introduced to other sectors such as the hospital, healthcare, to provide a lot different use cases for the internal operation.
Yeah, I got you. And lastly, as things start to ramp up on day 2 at Digital Health Festival here, I'll let you start speaking to attendees here. But what would you hope that attendees that do come by your booth here at the event kind of take away? Like, where is this the future of this space going, or what should they do for me?
Yeah, look, similar to our discussion that we've had here this morning with you, Peter, is being aware that there are solutions to improve mobile connectivity first and foremost. So if we separate the essential connectivity, being able to do those simple things such as make, receive phone calls, messages, we want to make sure that the visitors that come to our booth and the attendants here at DHF are aware that there are solutions to improve that mobile network operator experience. They don't have to do anything. And as I said previously, mobile connectivity we're expected to be seamless wherever we go, right? And then looking forward, you've got private mobile networks where that's more at the moment positioned towards the healthcare provider, where there may be use cases that could improve their business efficiency and or safety. That's what we'd like to be able to convey to everyone that is attending our booth.
Perfect. Well, gents, I've learned a lot around the connectivity side and probably a few new acronyms too. We always need some more acronyms in healthcare. So
We love it, don't we?
Adrian, Kevin, I really appreciate your time.
Thanks, Pete.
Thank you.